How does psychotherapy work? Well, there are many types of psychotherapy, and the short answer is that the therapist provides a supportive, non judgmental platform for someone to talk to about their thoughts and feelings. Many times, a therapist acts like a sounding board, can help one think about their life in another perspective or shed new ideas, and it's really the patient's trust or bond in the relationship between the patient and therapist, which is thought to be the most important role. Therapists can also provide other skills such as help with various techniques like to deal with depression, anxiety, sleep problems, maybe just ill feelings in general. Many therapists are also trained to recognize when people are having incorrect or wrong thinking. For example, if they're looking at situations as black and white, if they're just focusing on the negative, or maybe minimizing the positive in their life. The therapist can also help the patient work through this incorrect thinking and so help someone to think about it in a new way, almost like an exercise. In a way, it's sort of exercising the way one thinks or views maybe the world, maybe themselves, or maybe views those around them, and trying to recreate their thinking so that they're thinking about it in a good, healthy way. Keep in mind that even though the therapist ideally is providing support and non-judgmental, they are human, they make mistakes. Don't beat them up about it if they seem to be giving you a difficult time. In fact, be sure to share those thoughts and feelings with them. This might be a crucial point of self-discovery and a sign that you could be acting in that fashion to other people in your life as well. Too many times there seems to be a crucial point in treatment and people will inform me that they stopped seeing a therapist because the therapist acted in such and such a way, when the real therapeutic effect would be to tell the therapist about what you were thinking or feeling at the time. Also, it's not uncommon for there to be romantic feelings towards the therapist or even anger or maybe frustration. All of these are important to share with the therapist as well, as it can provide valuable insight into what's going on with one's psyche. The more honest you will be, the better. But if you mention that you want to kill someone or yourself, or there is reports of child or adult abuse, then these are some grounds that confidentially can and should be broken by the therapist. Psychotherapy does require a good amount of time and money on the patient's part. Sometimes it requires weekly sessions that are 1 hour long, so be sure to go regularly and show up regularly. In a way, it's disrespectful to not show up to the appointment because it costs the clinician time, as well as that's time that could be used for other people who want to get into sessions. So do your best if you need to cancel or change to give advance notice, but again, try not to stop treatment without first discussing with a therapist the reasons for stopping.